By Designs, and I'm your host, Andrew Whitfield Cook. Joining us today is Jacqui Coote, a pharmacist and nutritionist who owns the Whole Life Pharmacy in Strathpine, Brisbane, and today we'll be discussing patient-centred care. Welcome to Wellness by Designs, Jacqui. How are you?
Very well. Thank you for having me.
Thank you so much for taking time out of your busy day. I know how busy it can get in pharmacy. So, I think first to start off, did you do nutrition or pharmacy first? What drive you?
I did pharmacy first, and to be honest, I picked pharmacy because I loved science, but I also loved people, so it seemed like a natural fit for me. But I was very young, so I didn't know what I was getting into.
Oops. What about nutrition then? Why go further into nutrition? It's not the obvious step that most people make.
No, so it was definitely nothing that I'd ever really forward planned to do that either. But throughout my pharmacy journey, I'd really grown to love helping people, and that's what made my job rewarding. And it was actually my customers that wanted to know more about health, natural health, and how that would benefit them. And I really felt like I had to do further study to be able to answer those questions effectively and really make a difference in people's lives. And that's why I chose nutrition, but from a natural medicine perspective, because that's what I was interested in, learning the philosophies behind natural medicine therapies and learning it from that perspective. So that's why I picked nutritional medicine rather than, going into dietetics, for instance.
Gotcha. Yeah, gotcha. Okay, but that's a big leap. Like when not sure about nutrition, but certainly naturopathy. It was a big leap for me from a paradigm perspective, if you like, to go from a disease model to a wellness model, or a rather instead of a diagnosis model, to a problem-solving model, if you like, with natural medicine. Big issue for me. Like, instead of saying there's lupus, a naturopath would say there's a patient, their diagnosis is lupus, but they've got problems with their skin integrity, and that's linked to gut dysbiosis and inflammatory markers and things like that. So instead of tackling the diagnosis per se, a naturopath will tackle the body systems that are out of alignment, if you like, or out of balance.
Yeah.
How did you grasp that?
I think, I guess I live in both worlds, so I guess I still think both ways. But the more you see people and the more you delve into your own health journey as well, you realize that people are not just body systems or a disease, and we are complex beings. And, it's not just about the process that's going wrong in that one little area. It's about the whole person. So I think it fits quite naturally once you start to think about, the things that can lead to disease, for instance, even lack of sleep or living in such a stressful environment that you're not taking time to break that cycle and help your body to maintain its integrity, so to speak. I think it fits quite well hand in hand, those two.
So this need, or this interest, if you like, that drove you to study nutrition, it was indeed patient-driven. It was the demands of the patients wanting more info.
Yeah,
what were they after?
I think at the time, because I'm going back maybe at least 10 years, probably, when I first started getting really interested in it. I'd say it was probably more digestive health was probably a big one at the time that really got me interested, but probably because I think I had some of my own issues that I was like delving into, as far as like, what could these probiotics do, for instance? It's a very simple thing, but, even back then, they're way more complex now, all the research that's been done on probiotics, but back then there wasn't huge amount of choices, but even the few that were available, I wanted to know a bit more about why you would pick one thing over another. So I started going to natural medicine conferences, and I just found this whole other world, and it was way more detailed and researched than I had been led to believe, basically.
Same here. I went through that exact same discovery. What are the most common inquiries that you get from customers, patients, that you feel you have the greatest impact on?
Yeah. Well, I guess I'm in a fortunate position where people are walking through my door. I get to see hundreds of people every day. So there's a huge variety of things that people ask for help for. But I guess we see definitely a lot of digestive health issues is a really common one. Headaches and migraines and mental health, they're probably three big ones that we see a lot of, and they're three big ones that I feel works really well for integrative medicine and helping people with a natural option as well as whatever else they're doing. It can work in quite well with what they've been prescribed. It's really helpful being a pharmacist, so I can have a look at their regular medications and provide advice on what is going to be safe to use with those combinations. But yes, I'd say they're the three biggest areas that I feel we can have big impacts in.
Sticky situation sometimes, though, in that, it's not really our place, your place, to sort of take patients off medicines. That's the doctors. So sometimes, though, you get patients who start to refuse medication that may be indeed life-saving. So let's say, and I know this is opening up, I'm going to be kicked in the head, I know, for this, for suggesting that statins might even be of benefit to somebody. But it's not our place to necessarily take patients off statins. But if their lipid profile is such that it's low, then of course the doctor should be in the position, therefore, to say, listen, maybe we can cease this. But if we take a step back, do you actively say, okay, doctors put you on a statin, this is great for lowering blood cholesterol levels, but it doesn't look at this, this, and this. Do you activate the conversation, or do you wait for the patients to activate the conversation?
Look, I probably more so wait for the patient to activate the conversation, in the sense that pharmacy has been under a lot of scrutiny in the past with do you want fries with that type of nutritional recommendations? Just definitely recommending certain things with each prescription. It's not really what I want to be seen to be doing. But I think the ideal scenario with pharmacy is that we're going to be seeing people usually on at least a 1 to 2 monthly basis, for instance, if they are on a medication. So it's about, for me, developing that relationship with the person, so that when they're ready to discuss, their health concerns, then I'm there to be able to step in and give that advice. So I don't actively discourage, I would be very quickly actively discouraged, certain prescriptions being filled or things like that. I don't take people off medication, but
no,
I guess I like to think that the relationship is the most important thing, so that when people are ready or they've got a query about something and they want to address it from a different perspective, then I'm well placed to help them.
Yeah. So conditions, like if we go through, you mentioned digestive health, headaches and migraines. So actually, let's start at digestive health, because it's a huge one. So are we talking about things like, the old salts, the antibiotics with probiotics and things like that? Or do your patients ask you about more complex issues?
Oh, yes. I mean, yes, there is that I wouldn't want to say basic recommendation, but it's a very common recommendation and a very necessary one with the antibiotics and probiotics. But I feel like we can help with more complex things. I think, reflux is one very prevalent condition that we can have a huge impact with, and especially now that PPIs are becoming less popular from a medical perspective because the side effects of long-term use of PPIs are actually becoming more well-known and seen. So I think that's a really good thing, because then people are coming in wanting to know what else they can try that isn't going to have those negative impacts. And I think, digestive system, because anything we put into our mouths is touching our digestive system, it is actually a fairly easy system to have an influence on with natural medicine and diet, because you don't have to think about absorption and all those other things that make, other formulations difficult to perhaps get into the body and get the effect that you're wanting to see with them.
So can you give us a few examples here, though? So let's say, PPIs, one of the classics is things like zinc carnosine, for instance, or even something nice and simple like slippery elm, as innocuous as that, these innocuous fibres. Do you tend to favour anything one over the other, or do you use them concomitantly?
Digestive health, often there is a few different things that you've got to consider. And if something's going wrong at the top with like reflux, it's not often an isolated issue, like thinking about motility through the whole digestive tract. So if someone's constipated and they don't have good bowel movements, then everything else is just not going to work as effectively as it should. But I would definitely consider each person individually based on what their diet is. Are they drinking a lot of alcohol? What's their stress levels like? But as far as things that I commonly recommend, I do use bitters a lot to help, because I think reflux, it's not necessarily an acid issue. Like it's more so an issue with the esophagus being too relaxed and letting things back up where they really shouldn't. So I do find bitters work really well for constricting the esophagus to make sure there isn't contents refluxing. We use different fibre supplements, especially we use a lot of PHGG, partially hydrolyzed guar gum, because I think that has the dual benefit of improving the bacterial profile in the digestive tract, as well as it can be helpful for both diarrhea and constipation, depending on the dosage. So I use that a lot. Different probiotics use a lot. Slippery elm still widely used, but I probably more so go for the PHGG as something that I gravitate towards, unless there is burning or something you want to help with coating of the digestive tract, like with slippery elm.
And what about in the pharmacy realm? What about using the alginates at all as a raft antacid? Do you ever employ that with like after meals, and so that people can get afford some benefit from the actions of that?
Yeah, definitely. I mean, that's probably my go-to. If I was going to use an antacid, I'd use one with the alginate. Yeah, definitely.
Okay, so antibiotics. Now, this is a huge issue, and I've got to say I've now swung away from this use of probiotics or bacterial probiotics because of compliance. So I tend to just favour Saccharomyces boulardii with the antibiotic, because it's just, there's no issue with compliance. It's take that with that at the time, What do you use though?
I love Saccharomyces boulardii. I've always loved it, but I have moved away from using it, interestingly enough, to using normal probiotics, which is, it's just based purely on customer feedback and people coming back saying how good they've felt on different formulations of probiotics. And I guess there are some researchers out there saying that we don't really have to worry about timing, so just giving it at the same time as antibiotics now too, so that seems to be working fine for people as well.
Fair enough. Any particular genera or species that you favour?
I must admit I'm terrible at remembering all the specific bacteria, so no, I won't. No. I won't guess.
No. All right. So what about migraine? headaches you mentioned
Mm,
previously. Now, there's good
yes.
evidence here. There's a lot of migraineurs that don't do well. Having said, these new calcitonin gene inhibitors are just a game changer. But still there is a section of the community that they still have, let's say, breakthrough migraines. What
Mm.
do you do to help these people?
Yeah, I actually feel like sometimes migraine is maybe misdiagnosed, to be honest. I think a lot of people have headaches that are called migraines, but I do believe it might be something else causing them. Um,
Yeah.
but I like to take a full history with migraines. It is probably something I'd prefer to see in the clinic room rather than just a quick consultation, because I feel like it really depends on the person as to what I'm going to recommend. But I think something that I look for now more so with migraines as well is someone's histamine tolerance or intolerance. So I think a lot of people in the pursuit of being healthy can sometimes have things that may not be, so they are considered a health food, but they're not actually great for that particular person. So I think, one example is a lot of kombucha or fermented foods. Yes, they've got great bacteria in there, but they also have a lot of histamines. So if I identify that someone's getting quite frequent migraines and they're having a lot of fermented foods, I trial a reduction or a removal of those foods to see if that improves the frequency. And I might even look at using quercetin to help with the histamine response as well. Yeah.
And any particular dose that you use of quercetin?
I like to use, well, what is it? It's about, I'm trying to think what the supplements dosage.
Anywhere between 200 to
I think
600,
they're,
I've seen.
yeah, I was going to say 400 to 600. I use that 3 times a day, so
3 times a day.
about 12.
Cool.
Yeah. And then it
Because I
can
love
be,
quercetin.
yeah, it's
Different
actually, oh yeah, well, it's actually very versatile nutrient as well.
Extremely.
Yes.
Extremely. Okay, so headaches, mental health. Now, this is an interesting one. So I can remember when I worked full-time in a pharmacy and, I saw my fair share of mental health issues and people seeking help from that. That was in an era where St. John's wort was the new kid on the block, if you like, and it was in favour.
Yeah.
Since then, there has been this whole evolution of nutritional herbal means of helping people with mental health issues. And it seems like St. John's wort has fallen out of favour in favour of things like Afron and I'm going to say other nervines. I've gone blank. Forgive me. But
Lemon
yeah,
balm,
well, like what's
passion
been
flower.
your lemon balm? Yeah, passion flower. What's been your experience of what helps, and how in depth do you have to get, or do you have to delve with these patients' histories to sort of find out what might be some triggers?
Mm. Yeah, it's interesting because I think St. John's has gotten St. John's wort had a bad rap just because of the
Mm,
interactions, and but it is probably one herb that doctors do actually recommend people to use semi-regularly as a starting point before they put them onto medicinal antidepressants. So I think it still definitely has a place, but yes, it does have more considerations with interactions and so on. But I guess because a lot of people that I see are already on prescription antidepressants or other medications for mental health, then I love things that I know they can use together with no issues. So I do use and recommend a lot of saffron and turmeric, explaining that it's working in a different way. It's not just increasing serotonin, so there's not really that risk there of serotonin storm, but it is going to help
syndrome.
people think more clearly because it's working more so with the BDNF. And I think a lot of people find that their pharmaceutical medication. It is working, but it's only really doing, one thing. It's not helping them overall. Like, it's quite narrow. So yes, they might be able to get up and do the things that they need to do each day now, whereas before they were on the antidepressant, they couldn't, but they still can't think clearly, and they still lack motivation to, think longer term and things like that. So that's where I find adding in those other herbs can be really beneficial. Sleep patterns are often still disturbed. So looking at magnesium and passion flower, California poppy, all those things that work really well for that deeper sleep.
Yes.
It's really good, and that's really improving their mental health as well, because they feel like they have a choice in what they are doing to support their mental health. And I mean, there's so many different conditions under that umbrella of mental health too. So we have a lot of population with ADHD. They might be on stimulant medication, but they're finding it difficult to relax at night time. So I love being able to use theanine. I don't really see any issues with using that with most things. It's safe with children as well. So yeah, there's lots of options, and I think having options makes people excited as well, because customers often come to you because they feel like they've exhausted all the options. And then you say, oh, hey, have you tried such and such? And they're like, no one's ever told me about that before.
Well, it's such an important point you make, because I remember an example of a child who was he was weeping because he felt just so bombed out because of not the first dose in the morning, but it was a second dose at, I think it was 10 o'clock or 11 o'clock. And he was saying, please, can we just put it back? Just put it back. That's all I'm asking. I'm not saying that I don't want to take it. I'm just saying, can we put it back till 12 or 1? And he was pleading with people who, of course, didn't listen. It was heartbreaking, and if patients are offered, or if they can talk to their pharmacist in an open manner with these things that may help their child, God, what a different healthcare system we'd have. I mean, seriously. Just huge differences. So L-theanine, I love your use of that, and particularly with kids, because it's safe. It's big.
Yes. And it's not hard to give it either, as in it doesn't have the taste issues that a lot of things have either. And because you can get it in a powder, it's very easy to, adjust dosages and so on. So, yeah, I love being able to have the use of theanine.
Well, practically on that note, what sort of dosages do you use? Obviously, this is something that is not a one-size-fits-all. What's your range of dosages that you use with L-theanine?
For kids or adults?
Yeah.
Well, kids, I guess 100 milligrams is probably where I'd start. But you can go higher, depending on the age of the child and the circumstances. But, yeah, I'd probably start with 100 milligrams.
Cool.
But yeah, I think
adults?
Adults, I'd start with 200 milligrams
Gotcha.
a few times a day, depending on what you're actually trying to achieve with it. But yeah. But I also, being a pharmacist, every person that I see, I usually just do a quick double check of my resources before I decide on a dose. So yeah, I'm always double checking things. Yeah.
Okay. And with mental health issues, like, for instance, so anxiety, for instance, and people who are just absolutely worn out, and so they're in this constant sympathetic drive. Is there anything that you favour using in these people?
I actually love using ashwagandha in those people.
Okay.
And then depending on whether they're, struggling for energy or not, you can add in the B vitamins, but sometimes I don't always use B vitamins. I do find ashwagandha very versatile. And then again, just looking at their ability to relax at nighttime. But that's where I would use, magnesium formula if they are struggling with sleep or just feeling anxious at nighttime. Magnesium formula is usually really good as well. But yes, I do like using ashwagandha with them.
Gotcha. Jacqui, can I ask, because I've seen this is just such a huge issue in pharmacy, the amount of women particularly, but not solely, but let's just concentrate on the female population because it's known, just how many women suffer from iron deficiency anemia, and they
Oh,
have
yeah.
real issues getting their iron up, like real issues.
Mm,
Is
yeah.
it iron that's the issue? There's a
I
seminar.
actually don't think it is iron that's the issue.
Yeah, so let's delve into this. How do you navigate this? What do you use?
Oh, look, putting me on the spot here with this one. It's more just what I've been thinking about. I haven't really researched it, to be honest, but like just knowing how the body sequesters iron when it's under attack, say, for instance, with an illness, you start to question what long-term stresses is the body under that might be causing it to not have iron readily available like it should. That's kind of where I've been thinking.
Yeah.
But as far as like how to actually help, I can honestly say I haven't really gone too far into it, except to think about
me thinking now.
Yeah. Yes.
So you're
Iron's a
thinking
complex one.
about the possibility of hepcidin being activated in not just
Yeah.
iron insult, but also infective insults or stressor
Yes.
insults.
Yes.
Right.
But I haven't researched it.
It's my next pet project.
It's just where my brain goes with it.
No, that's really good. That's really interesting. I'll look into that. That's cool. So Jacqui, what else? What else do you use nutrition for? What do you commonly sort of see in the pharmacy that are the big issues facing people?
Oh, there's so many. I think,
Constipation.
and it's very, yes, constipation. I think people very rarely just have one issue too. They more so have more than one.
True.
So it's you can go in thinking I'm going to treat this person. You've got the best, protocol or recommendation for constipation, but then they'll throw oh no, I'm allergic to this, or I can't tolerate this, and then you have to reinvent your whole. So that's why you can't just go in with like a rule book, for instance, of XYZ patient has these symptoms, give this supplement, because everyone is so different. And I think that's why I loved nutrition, because it was almost more creative. You've got to be creative to help the individual, because you can't just go by a textbook or a rule book, because everyone is so different with it. Yeah. But I think, constipation we see all the time. Diarrhea is actually kind of a fun one to help people with, because it's probably more, has such a huge impact on people's social lives, uncontrolled diarrhea. Then constipation is difficult, but it's, more easily managed. I feel like people that have chronic diarrhea is something I feel like challenged to help people with, because often it's, figuring out the cause of why the body is doing that. And there's multiple reasons why it could be. Hormones, I feel like I can see you've got the Ruth Tricky book in the background there. I'm about to reread that, because I feel like I need to brush up on. I've got so many, perimenopausal and menopausal women that really, really want help, and I feel like I need to relearn that whole textbook. But yes, they're very common. Yes. So yes.
Okay, so what about, we're talking about people who are very often on medications. You get them to come in, potentially you'll say, listen, this is complex, we need to have a consult. That may require some dialogue with the medical professions and indeed other professions. How do you respectfully interact with these other professions, because they come from a paradigm where very often they don't believe in nutrition?
I think you'd be surprised, though. I think a lot of doctors really, there's lots of different practitioners we're talking about here, but I think the one I find the most scary to interact with is, doctors, because they do have a respect and they have done a lot of training to get where they are. So you don't really want to go against their opinions. So I guess you know what you can do to consult the practitioner, but I think if you do really believe that something strongly should be changed, then you have to write them a letter or give them a call. But I think patients also advocate for what they want. So, I've had people that definitely want to come off medications, and I haven't initiated that. That's what they've come to me wanting help with. And I, tell them, well, you really definitely need to talk to your doctor about that, because for a number of reasons. Firstly, they need to be overseeing that, but also if the doctor keeps prescribing a prescription thinking that a person is taking it, and then they see them down the track and their condition is worsened, they need to know that they haven't been taking that medicine. So yes, I think at the end of the day, we are all people, and I think having the ability to just write letters and pick up the phone, it will surprise you how well you can actually collaborate together. Because a lot of times these people have been seeing the doctors, and the doctors have actually run out of ideas, so they're actually thankful for a different perspective on what could be tried. And if the patient's coming in saying that they're getting results from that, then they're often happy to continue. But I think they just want to be informed and know that that's what's happening. And I think definitely they should be informed of that.
Gotcha. Jacqui,
but as far as working with like natural, as far as other natural medicine practitioners working together, I think that's fantastic and shouldn't really come with too many issues, you would hope. I mean, I have a naturopath on staff, and I really enjoy collaborating with her too.
Right. Okay. Yeah. Jacqui, there's so much more that we could learn from you, but thank you so much for taking us through some of the essentials that you see in community pharmacy, helping your patients to achieve better health outcomes. I really do appreciate your work. You've done this for over a decade, I know, but to see your growth and your confidence in what you do, you have become a real, a stalwart, if you like, a vanguard for patient health and patient advocacy in your community. So thank you for all the work you've done over the years.
Thank you. Thank you for having me.
And thank you, everyone, for joining us. Remember, you can catch up on all the podcast notes. We'll try and put as much information as we can up there on the Designs for Health website. And, of course, all the other podcasts. I'm Andrew Whitfield Cook. This is Wellness by Designs.